any barriers or any challenges that arise?
Now needing dental care. There's an interest also in boutique services, a little bit more now sometimes than even before because of the fact that there's less boutique in some areas and more corporate. The benefit of the boutique services, and this is what patients are looking for, that they can offer more specialized and timely care and also individualized treatment plans versus something that's a little bit more standardized or corporatized. There's also more support services now and solutions like DSOs, MSOs, consultants, ancillary services that used to not be present years ago. Even 10 years ago, they used to not be as popular. So now this is, again, more on the forefront. Some of the negative trends that we've seen with the practices, certainly anytime you own a practice, human resources is number one up there with employment issues. That basically consumes 80% of what you're doing in the office. And if you haven't experienced that now, and maybe you haven't paid attention to it, but that's essentially the biggest issues that all practitioners have with private practice and corporate practice, obviously. Staff turnover, labor laws, compliance issues. I mean, there are policies and laws out there that we're just not aware of, and they're also all the time changing and being updated. So if you're not in compliance, you may be audited, and you may actually get letters from the board in regards to you not abiding by some of the policies or even laws, certainly. Challenges of leadership. Well, so what do we mean by challenges in leadership? Well, a lot of times, as a leader or the practitioner, it's difficult for us a lot of times to kind of carry our treatment plan or our goals or sometimes even our philosophies all the way down to the patient and see it follow through. So the goals of work being accomplished, it's really hard that's a huge challenge. Delegating to competent staff. I mean, competent staff, right? Like, are some of these people competent enough to even understand what you're trying to delegate or transmit to the patient? Onboarding. So what is onboarding? Well, onboarding is basically getting new staff and getting them on par, training them. So are you able to do that clearly with your mission and philosophies in place? Very difficult in a lot of circumstances. The other thing that we always deal with all the time is an unstable economy. No matter what, the economy is always said to be unstable here or there. But for the most part, and I have to say, the economy in your community can be very different from the global economy as well. So, and vice versa. So a lot of times you may have a great community economy and very stable, but the global economy may be in a lot more recession or inflation. So we've experienced things of that nature, especially in New Hampshire, where we've found it to be a little bit more sheltered than what's actually going on globally. So less unemployment, not as much inflation, and certainly the recession, not as much recession. So fortunately, knock on wood, that kind of continues in our communities. But overall, the dental services appear to be fairly stable and fairly resistant to a lot of the global trends and regressions and things of that nature. So that's been pretty fortunate in our field overall. So that was practice trends. So what about patients? What are the new trends that we see in patients? Well, first and foremost, now they're all tech savvy. Why? Well, because technology is all over the place now. We're all ingrained into the web, especially now because access is so much easier. Everybody's got an iPhone. In China, there's 1 billion iPhones or more. So it's immense. So website is really important. Digital marketing is very important. Online reviews, you see that all the time. So patients always looking at online reviews. Telehealth. This has become incredibly important and also very popular since 2019, 2020, since COVID. A lot of consultations and a lot of medicine has gone through, and even dentistry has gone through some telehealth. Obviously, apps on your phone, messaging, texts, apps, online scheduling, online check-ins. All of this has made for convenience overall in terms of dentistry and also the way that the office is run. Also, because the technology is kind of more prevalent and ubiquitous, and also with the information, the insurance are also a little bit more transparent. There's also alternatives out there that patients are also looking into. So they're going to come at you with questions about, well, what does this insurance do? Or does my insurance cover this or that? And you want to obviously have some ammunition to give to them. You don't want to be the practice that doesn't accept this or that and not know how to make the claims in order to receive the reimbursements as well. Again, with the influx of information and the myriad of and the plethora of information, I should say, natural alternatives to medicines and substances are very common at this point. So it's important for you to be up to date on some of those because patients will use natural alternatives, and you'll find some of the side effects being an issue, especially when you're performing surgery on them. And you guys have maybe have had some experience with that, certainly. And obviously, overall, it's just more convenient and consumer friendly because of the technology as well. Now, the elephant in the room now, and I say now because AI is becoming really, really popular. I'm sure you guys have heard about the chatbots. Google has been working, I think, since 2019 on something called Bard. Microsoft has something called Copilot, and essentially it's more than a chatbot. It's not anything like you'd find on Terminator, all right, where they make decisions for you. But a lot of what AI does is it collects the data and it just spews it out, not necessarily having the decision-making capacity, even though it doesn't seem like it. But the benefit of the AI is it's great for repetitive work. So for instance, assisting diagnosis, treatment planning, and patient education may be great to implement AI. It also can help dentists optimize their workflows, reduce errors just by doing assessments of production and collections in terms of costs of materials and things of that nature, just kind of keeping track of those things. It can obviously reduce the dependence on staff, on certain staff, especially in terms of if you have a staff member engaging in things like the supplies and things of that nature in the office. The downside, obviously, is that because you're so webbed into the technology, there's an increase in risk of cyber attacks and social engineering attacks. I'm sure you've heard of avatars and people actually taking your ID and distributing the financial information or personal information into the dark web. So that's a lot more common, obviously, now. Increase in competition's ability to do more. So now that everybody's on the web, there's a lot more competition on the web. So now you have to be a little bit more on top of things. Because the technology is also out there, it tends to, and ever evolving, it becomes outdated a lot more faster. So again, that becomes a little bit of a problem because now you have to stay on top of things. And this is all on top of you working as an oral surgeon or a dentist. So overall, there's also, because of all the information, you're going to be spending a lot of time just reviewing the ocean of options. I should really say oceans of options. I mean, how often have you sat there and looked at the various companies telling you, well, this is the best implant, or this is the best bone grafting material, or this is the best CT to kind of identify certain pathologies. And I'm sure we've all done that. And we all know that our friends, the general dentists, do that all the time with their materials and supplies.